wonderful Facialteam is. When this is over, I hope everybody knows, because I think the world, your whole organization.
Thank you. Hang on, I'm just going to silence this.
And we'll be with you for 1 hour.
Silence this. Yeah, we're live. You know that.
We are?
We are. So let's get the party started, as I always say. Hello, planet Earth. Welcome. I'm Lilia. My pronouns are she and hers. Thank you for joining us for the 13th episode of DM Maynard's reflective conversation series on gender affirmation for parents, partners, educators, health providers, and more, which is part of our platform aimed to visibilize all gender affirming topics. And today is a special day, as we can tell, because for the first time ever, we have our real host and creator of this series, DM Maynard from New York, here. Welcome, D.
I'm so happy to be here. Thanks so much, Lily. Thank you for the invitation, and I've looked forward to this for months.
So also today, of course, last but not least, I would like to introduce Dr. Capitn of Facialteam, and who joins us today for the interview from Marbella, Spain. So thank you so much.
I'm very happy. I'm a pleasure, Lilia. I'm very happy to be here. I'm so proud, and I really thank you, Dr. D, for being here. It's such an honor. So yeah, I think this is going to be a really good interview.
Oh, thank you, Dr. Capitn. Thank you so much.
So D, a lot of people are saying Dr. D. Are you a doctor?
No, I'm not a doctor, but I wish I was, but I'm not yet. But many people just make that assumption. So I feel very flattered that you do. And thank you so much. But Perfect. You know what? I'm going to learn from you.
Okay. I hope I can give adequate answers. I will try to do my best.
Oh, no worries.
So thanks everybody that's here in the chat. Let us know if you have any questions about what we're going to talk about today, which is basically FFS and Facialteam. So if you have questions about Facialteam, I'll be happy to incorporate those into our conversation. So D, can you tell us a little more about yourself for our new viewers that don't know?
Sure. Okay. Well, I had the pleasure of presenting at different conferences, and I'm an educator first and foremost. I taught in the classroom for more than 30 years, and then I was presenting at conferences about how to work with and help companions, parents, partners, educators of people who are in transition or questioning their gender also. And so I got lucky enough to be asked to write a book for partners. And then after that, to help a partner navigate the transition for themselves. And then after that, one for parents and family members of trans and non-binary children. And then after that, for educators and support staff. And so that's how this all came about for me to be part of this journey.
Fantastic. And we have copies of your books now, and all of our consultations at Facialteam and our aftercare program have copies as well. So we'll talk a little bit more about those later.
Sure.
And we'll show them. But I would like to also mention how we met, no?
Yes. Why don't you do it? Because you usually ask me to do it. And now that you're, because Lil is usually my partner in crime here, but today she is one of the guest stars. I know she doesn't like the word stars, but to me, she's a star. And I say Dr. Capitn is a movie star.
Call me Luis, okay? I think it's better.
Sure, of course.
Easier.
Yes, Luis, thank you so much. Okay, great. Thank you.
So just to quickly mention, I was at the Philly Trans Wellness Conference thanks to Facialteam, because we went over to New York for an event, and Dr. Capitn and other doctors were at Johns Hopkins University doing a conference with other professionals. And so I took advantage of that to go down to Philly Trans Wellness with my colleague Carmen, who's one of our patient relations people. And we met through a mutual professional, Christy Block. Thank you, Christy,
Thank you
for introducing us. And so it's coming up. I just wanted to do a little plug too, the Philly Trans Wellness Conference in 2019.
We met.
That's when we met, and we started doing the show about a year later, we did our first episode, and since then we've been going every month.
Right,
Yeah.
and at the beginning, I wasn't sure whether to do it. Do you remember? And
I had to talk to her at least 100 times.
you know, I was so nervous, and now I love it so much. And I really had heard such positive things about Facialteam, and I just adored you, Will. And I knew that we clicked, and I really thought that there was an opportunity to really educate people about different topics related to the trans community, as well supporting the companions. And then everyone that I knew had come to Facialteam just had the most wonderful experience, the people that I spoke to, and I thought I will be so proud to be part of this with you. And so thank you.
No, thank you. We're honored to count on such a wonderful professional like you to continue this type of education, because it's very important to us, not only to put out information there for our patients, but also for the companions, the parents, the partners, family members that come with them. So
Right, so let me ask Dr. Capitn, Louise, let me ask you a question.
Sure.
So what could you tell us about Facialteam and how the idea of this surgical team came about?
Yeah. Well, actually the Facialteam was born as a need. I think it was born as a personal and inspirational need. You know, in 2010, Daniel Simon and myself, we realized the profound impact performing FFS had made in our lives. But we also realized how much work it was need to do in terms of professionalizing protocols, scientific research that was really low at the time, the standards of care, etc., in this amazing discipline. So we were motivated by how much could be done. You know, it was kind of a big, giant challenge, and this is how Facialteam was born.
Okay, so then what would you both each share with me about your background and explain your role at Facialteam?
Just start, Lilia.
Okay, Lilia.
Okay, sure. Well, yes, I'm originally from Maine and began working with Dr. Capitn and Dr. Simon in 2008 as a receptionist. They needed an English-speaking receptionist, and yeah, since then a lot has happened. Facialteam has grown, and now I spend most of my time as a community manager. So a lot of people meet me on social media and other patient relations for Facialteam.
Yep. Well, I'm Spanish, as you can see. I was born in Granada, that is a city in the south of Spain, and professionally I'm an oral and maxillofacial surgeon. I was trained here in Spain and partially in UK, and for many years at the beginning of my career, I worked mainly in craniofacial oncology reconstruction. Then in 2006, I think it was 2006, I had the privilege to observe some FFS, okay? And, you know, it was something completely new to me, something I even didn't understand very well. But I think I could see at that time the potential behind this surgical discipline. Nowadays, I'm one of the surgeons from the Facialteam, mainly involved in forehead reconstruction and thyroid cartilage recontouring. I'm also the co-director of the group, together with my dear Daniel Simon. So that means that I run some of the decision and strategies behind the group. But fortunately, I'm surrounded by a amazing group of people with amazing brains, and these make decisions, strategies far more easy.
Yes, you know, that's why we titled this "Getting to Know All About Facialteam." Lil and I always talk about getting to know I want people to know about you and getting to know all about what you do, right?
Exactly.
Yeah.
Getting
To know you, getting to know all about you, getting to like you, getting to hope you like me. We prepared that for you, Luis.
Oh
We
my
make you
God.
smile and do a little duet
Oh
about
my
getting to know
God.
you. It's from the
What
King
a
and I.
beautiful singers I have here.
Sorry, back to profession.
we just wanted to surprise you with that. So what is the purpose and goals of Facialteam at this time?
But I honestly think is a combination of purposes. Let's say that it's clear that the key reason supporting everything is our patients. So we could say that the main goal is the patient itself. We really want to offer our patients a singular experience where the high quality of surgery is something intrinsic to this experience. We aim to be more than a surgical group, and we aim to be like kind of an essential pillar serving the trans community. And to achieve this difficult goal, we need to accomplish some other important objectives. Understanding the trans community, its evolution, their demands over the years, what FFS means to them, and provide them an adequate answer. We need to evolve technically and scientifically all what we do, all the procedures that we perform. We need to increase the level of well-being and recovery during the post-operative time, the time the patients are with us. So as you can see, there are so many things to do that we could say that the goal is to keep improving what we offer to our patients.
Wow. So because we're an education series, I think there are some people who may not even know what FFS stands for, that it's an option and what that would entail parts of FFS. Would you expand on that and explain what FFS stands for?
Absolutely. We could say, I mean, because I don't want to sound very technical here. This is not a technical talk. This is a more divulgative talk. It's clear that there are some technical aspects in FFS, but at the end of the day, you hear me well?
Yeah, I hear you.
Yeah.
So FF stands for facial feminization surgery.
Give me 1 second. I lost my earring.
Sure, no worries. So yeah, so I think what's so important about this is that many people might not even know that this is an option who might get FFS.
Yes, and other people may not realize that as an option, it's not something that you need to have.
Exactly.
For some people and not for others.
Right.
And it can also be referred to as gender affirming surgery.
Yes.
Or gender confirming surgery. So it's not, FFS is sort of the term that was created a long time ago. And there are some other new terms that people feel a little more inclusive.
Right, with anything with medical surgery, it's an option. It's just so that people know this is available to them, and that, of course, what you said is true. No one ever has to opt to do something or not, but this helps people gather some information from an expert.
Yeah.
So would you go right ahead? It's nice to have you back.
Sorry, I lost it. I was saying that apart from what is very technical, let's say that FFS, or as Lilia said, facial affirming surgery, help people to show the identity they really feel comfortable with. So we need to identify which features in the face can interfere in the gender perception. So what feature in my face is making this person to look at me as a man or to look at me as a woman, and how we can address these specific features. So it's a very structural treatment, because remember, at the end, and here is a confusion, we are not offering aesthetic or cosmetic procedures. We are offering the opportunity to eliminate, to address those specific features that are responsible for the gender identification. Of course, there are different parts in the face that can be identified as a gender marker. My brow ridge is a key area. My hairline could be a key area as well. My nose, the shape, the shape of my jawline, my Adam's, my thyroid cartilage. So there are different elements in my face that can, as I said, can reveal gender. So, and this is what we can remove. This is what we can address.
Right. And so even for those who identify as non-binary, what combination would help them to portray and show that facially what's aligned with their gender identity?
Correct.
And their firm gender. So that's really very helpful. Thank you. Yeah, and the Adam's apple, I know with the tracheal shave, some people, that's what I know to be called.
But at the end, and I think this is important, it needs to be a fluid conversation with our patients. Why I'm telling that? For many trans women, they feel really comfortable with the Adam's apple. They don't really care about it, but they really struggle with the supraorbital ring, for instance. Other patients, they love their jawline, but they hate how their nose affect their gender identification. So we need to conversate with them. We need to find out how can we help them with the surgery. Let's say it's not an official list. You have to do hairline, forehead, nose. No. I need to understand what your goals are, what features in your face are bothering you in your daily life, and try to treat them. This is how I understand FFS nowadays.
That's what makes you your team so special, because you really individualize, you customize to a person's needs. And the people that I spoke to that have had surgery with you said that it's exactly how their experience was, is that you really listen to them, you have that conversation, and then you tell them what's available and let them know that do what's comfortable for them. And then later on, if they opted not to do something, they could even return if that was what they found later on.
Yeah,
correct?
Correct. I totally agree.
What I hear patients saying is that it's about their own perspective. You know, what some patients have dysphoria, and certain facial features trigger that dysphoria. And so that's why they seek FFS, but not all patients want it or need it. And so that should be very, very clear as well. And it does, and even for some patients, like Dr. Capitn said, you know, maybe they like their squared marked jaw, which is beautiful, you know, on a lot of different faces. It's not necessarily something, and if it doesn't bother them, though, you know, so for somebody who's non-binary, for example, it's not about gender dysphoria, but
exactly. Every gender dysphoria is different. We should not standardize the FFS. Otherwise, we are creating a very, very similar faces, and it's totally the opposite. We need to provide a face the patient feels comfortable with, whatever the features are. So this is, to me, this is how FFS has evolved in the last years, in the last.
We always talk about when we're speaking with parents and partners and educators to say everybody's journey is different, and every person who transitions or exploring their gender is different. And so no two people are the same in any way, always. And so this is no different. And so when a person comes to you and your team, they get to know what you're all about and what their options are, and that, like you're saying, it's not a cookbook thing. It's not, this is the recipe where you're going to listen to the patient's needs, what their concerns may or may not be. And also, you know, like, it's like the next thing I was going to ask you is that, are there any misconceptions that patients and others have about FFS, and then what are they? And I mean, one you just showed is that it's not a cookbook thing. Some people might think we're all going to look the same. This is key. This
is very important, and I think I think there are some misconceptions. Then remember, it's important to understand that FFS can modify the facial gender. This is a fact, But it's also true that we need to seek for the maintenance of certain natural aspects and for what we call the core identity. So the facial identity that is not linked to the gender, okay? And behind we have family traits, or we have ethnical traits independent of gender. So in my opinion, the majority of our patients, they understand very well what are we able to offer them by means of surgery. But in general, the main misconceptions are related. Number one, to beautification. There's a clear confusion between what FFS is and what cosmetic surgery is. And also number two, aggressive approach. For many patients, FFS is synonymous of aggressiveness, when actually, in my opinion, it should be totally the opposite.
The people that I spoke to actually discussed that and said that I don't know if this is exactly the right word, because translating from English and Spanish, it's not conservative, but it's not aggressive, and that you make it realistic. When you talk to people, you tell them what's possible, what's not at the moment. And I guess, you know, as a surgeon, you want to make sure a person can breathe well, they can move their face correctly when it's over, and that you're working with a structure that's already there. So if I, you know, wanted, you know, cosmetically, there's certain things that I may, if it weren't for me, I may not want, I may desire, but you may, as a professional, say that might not be appropriate for you at this moment, but we can work towards that. I mean, I'm guessing you might do some imaging. And I believe that you said that there's some people that help with some imaging to give you samples of what show a model. But also, I really never really thought about what you said before, to be honest, about culturally, family traits. Of course, that's so significant to have a resemblance to your, if you did resemble someone in your family before and you still want to.
Exactly.
we honor that. That's a beautiful thing. I honestly, it never crossed my mind.
Because, I mean, we are not changing the face by a different face. We are maintaining this face, eliminating what is extra in terms of gender. But again, I want my patients to look natural. I want my patient to maintain this core identity linked to whatever they like. They like the family traits. They like their ethnicity. Ethnicity is absolutely important, independently of your gender. I don't know if you agree. Probably you agree with that.
I agree.
So, yeah. And I want also to mention in regards to this aggression should not a word included in the surgical spectrum. So because aggressive is not a good word. We can do many things with surgery, but we need to remember that we need to preserve functionality. We need to preserve anatomy. We need to preserve strength. We need to consider so many aspects beyond outcomes that is not like I want to have a very aggressive surgery or I want to go to the limit. It's totally different, but this is probably more technical.
Yeah, you know, you use the exact word I was searching for. Thank you, functionality. That's what I was looking for when I was saying that before. So, Lil, when we're talking about the person who's having the surgery now, but of course we know that there are people in life, which, you know, my books I write about, is about the companions, the parents, the partners, the friends that support. So I'm going to ask you this, if you don't mind. And of course, Louise, please chime in anytime. How do you approach including companions of the patients in this journey, and why do you include them? Because I know you do.
So we do a lot of things to support the companions,
Yes.
be they partners, parents, friends, family, etc.
That accompany and come along.
Right. We have a staff psychologist who runs group sessions, and the companions are always welcome. The patient coordinators are there for the companions as well as the patients and are very communicative. So the people who come with the patient also are able to get all of their questions and doubts and worries answered before and while they're here and after as well. So, and also, we're really concerned about making sure that we're doing all the best we can in everything we do. And I think that shows in a lot of different ways. But in terms of the companions, you are here for that reason. And part of the reason Dee is here in Spain with us is because in 2 days, you're going to give a workshop to 40 staff members between the hospital and Facialteam. And we're going to learn even more about taking care of the people who love our patients.
Yes, and I feel really honored and grateful for this opportunity. And I feel more surgical teams and medical professionals, as well as mental health professionals, should be taking this into account, because I feel that everyone needs support and assistance sometimes, and people need to know what to anticipate, what to expect, and that the people that are doing what you're doing needs to also know part of their journey and their experience that brought them to come along, and what they don't know, what they do know, and where they've been before, where they are during the surgery, and what might their life be like afterward, what changes may occur for them emotionally. And always, though, the companions that do come are people who are often really supportive in many ways, and then may also have some of their concerns. So I'm honored to be coming. And so
Lilia, in regards to companion to this topic, one thing that we have been observing during the last years, and that is something, in my opinion, it has been a game changer in FFS, is how family are now more involved in all our patients' journey. It was something amazing. At the beginning, Lilia, you remember, all patients came along, all of them, 90%, they came along or with some friend. Now we see how important it is, and they come together with their kids, with their daughters, and how important for them and for the process to be together with the family is. In my opinion, this has been a real change. Do you agree, Lilia?
I agree completely, and it's from the accepting the family members into the consultation process, the decision-making process is so important. It's really heartening to see, this becoming a family sort of event, because they need this support. The patients really benefit from having this support network around them, and we're more than happy to include them in the whole process,
right?
And learning from that as well along the way.
Yeah, because and the thing that is unique to your organization, to your team, is that understanding that while the person who's in transition is going through things that they're experiencing and the questions that they don't know, the partners and the parents and the family members may have their own questions, and they want to be part of that process so that they can, if there is something that's not going correctly, they can maybe observing or noticing what's happening and be able to alert you, because with any surgery, sometimes things go perfectly, sometimes there's a challenge, or sometimes results, if a person is part of the process of what results might be from a surgery, they're able to be more supportive and understand things better themselves, so
absolutely.
Can
I just interject here for a minute, because we've got a conversation happening here in the comments, and
I'd love to. I love when people call in. Go ahead, hot off the press.
We've got callers, no questions, but just a lot of comments, and commenting on what we were talking about femininity and the results, and needing to be what that individual is looking for. A patient here is commenting how only 3 millimeters were taking off of their chin, but they realize now that was the perfect amount because it just created balance in their facial features. So thank you, Vanessa, Chloe, Danny, all of you here watching and commenting. We really appreciate you being here. And we look forward to seeing you when you can come. Regarding COVID, some people are commenting about COVID. We have COVID protocol and a COVID advisory. So if you have any questions about traveling with COVID, our coordinators are more than equipped to help you with that information.
Yeah. Going back to the Lilia, to the family topic, one thing I fully recommend to my patients is because that we make a lot of Skype consultation now because of the COVID has changed everything, and now we provide video consultations daily. I recommend patients to assist this consultation with their family, not the whole family, but with the father, with the mother. And the experience is really high because, of course, patients, they understand very well what are they looking for, what they need, or what they. But then the mom or the father, they can ask very other interesting questions. So it's normally a very good experience to have the consultation together.
Right, because everybody can be involved, and for families, and of course spouses, partners,
because ex-spouses.
That's what I was going to exactly say. There are many partners that I know that they didn't remain as a couple, but they're still fabulous friends, and they're there as the support team. And then there are other people who may not have a blood relative or a person they're in a relationship with, but it's a friend who really is supportive, their chosen family that comes along with them. And I feel that it's very important that surgical teams include them in the conversation and allow them to ask their questions, because sometimes they're the caretakers after, they're the nurses and the post people that need to be aware of what's going on. So Lil, do you have
I just want to say one more thing before we move on, is that for the family members that can't accompany their loved one, it's also important to realize that when a patient comes to the Facialteam and they're alone, they are not alone. They are surrounded by a massive team of caring, attentive professionals who have been doing this for over a decade, and we're used to helping people who come on their own. So really, that to have some peace of mind in that fact that many of the patients still do come alone, but we just wanted to give a little attention today that we're also really pleased with the fact that, we more and more getting companions.
Right, because it sounds like that's how it might have been more in the past. So I know you're very skilled at that. And the last episode, an episode that I saw you do on your own, Lil, that I wasn't part of, I got to see some of your coordinators and all it entailed and every aspect, and how they really love your patients and are really fulfill the role of extended family. And that even when the family members come and the partners come, they're still part of the extended family or team. And that you really follow them through and care before, during, and after. Is there any advice for those who are considering FFS at this time? And what would your advice be?
Sure. Yeah, there are lots of things. But really the community itself is much better at giving this advice than we could ever be. But what I can say that I've learned from listening to the community from a decade, moderating our Facebook group on FFS, is that first, I recommend remembering that this is going to take time. Plenty of time to figure out. It's not something that can be done on a whim, and it's not something that should be rushed into. So I'd say get on to sites like Susan's Place and others that are really similar, that have been around for a long time. Reddit has some really active groups that are talking about all kinds of topics, and they're really well organized. There are 2 communities on Facebook on specifically the FFS topic, and now there's some Discord groups. So there's a lot of different groups out there. I recommend reaching out to those, but nothing can replace having consultations, and that is of fundamental importance, and to have multiple consultations with professionals that you may consider for medical care, and get that personalized advice from them, because like we were saying, FFS is personalized. It's not something that's the same sort of plan. It's not the same surgical plan for everybody. So also, thankfully, There are many institutions nowadays that are conducting studies in the field, and Facialteam is collaborating with them, and we have already 25 published papers. So this is definitely a way to get a more technical and deeper understanding of the procedures. I would suggest doing all that research if you can. What do you think, Dr. Capitn? From a surgeon's perspective, what do you think would be for example, the best way to prepare for the consultation, which is so important?
There is no clear answer to that. Why? Because I think there is no a guideline to follow. There are patients that they are very focused in technical aspects, so they need to prepare these technical questions. How are you going to perform a surgery? Where are you going to incise? What's the best approach in my case? Do I need a transplant? So we have this group of people with more technical requirements. But then we have people that they feel more in the human side of the adventure. So that they need to hear you. They need to understand that you are going to be, as you said, Lilia, beside them during the process, during the experience. That I would say that try not to be too stressed during the consultation. This is something I normally find in my consultation. People are really nervous, and I always say the same. I don't eat anybody, so try to be relaxed, as relaxed as possible. The more relaxed you are, the better the information will get. So try to be relaxed. Try to think what's your main goals with the surgery are, and try to bring them to the consultation. Of course, we try to provide as much information as possible, and we can go from very low technical profile to a very high technical profile. So no guidelines, no nerves, and try to identify prior to the consultation what your goals are.
Right. There are two things that I think of in addition to what you both said. Is one is speaking to a patient who has already experienced this, and what the process is like for them. And I know that the people that I spoke to, because some partners, when I work with partners or families, they ask, do I know anybody who would be willing to talk to us that has experienced some, any type of surgery related to medical interventions? I can sometimes introduce them because people say they're willing to. I know with confidentiality, you can't just do that, but I have that ability. And another thing I think everybody shared was very valuable was going to conferences and meeting some of the surgeons and finding out, getting to know them interpersonally. I know getting to know you, we'll go back to that, but because it is the affect and it is the emotional tie to see your personalities, what you're like, your ability to explain things to them, and your different styles, your locations, the financial aspects of this, which, depending if you fly to another country, and understanding the different languages. And I know that you do everything in English, you do things in Spanish. And that's something very important that I think people may think, well, why am I doing it in Spain and why am I connecting? Well, I can tell you that everybody here at Facialteam has communicated to me with English because sadly, that's the only language I know at the moment, solamente. But I think that conferences is a way to do it. But I do want to just to touch on that, most of your staff is bilingual, and that is a very important aspect, yes?
It is, yes, it's important. And our coordinators are all with a certain level of English, so they're able to communicate. Our patient relations people have very fluent English. I'm, the one who's on social media, so I answer a lot of questions out there. So yes, language is important. We understand that, and our staff also manage other languages like German, Portuguese, French. Dr. Simon loves to speak in Italian.
Yes, yes, exactly. We'll talk about Dr. Simon maybe after, if we have time. I'd love to include. I know that you're very close, and he's a big part of this. Surgical
co-founder and
co-founder. Yes, exactly. Yeah. I was going to let you do that. So when you were just talking about the coordinators, and you interviewed two of them last time. I think you might have four, but I know that there are two. one thing that we did touch on, a conversation that you sparked, was a little bit about when you're working with, and maybe I want to call you Dr. Capitán, but I know Louise is that right, right, is okay with you, is that many transgender and non-binary folks speak of medical trauma. Based on your experiences and practice, what safeguards do you feel surgical teams should put in place to maybe alleviate this as much as possible?
Thank you, Dee. This is a very good question, and it's true. Seeing comparative photos in consultation can trigger dysphoria, and the surgery itself, as you know, is a physical aggression or a trauma to our body, so to speak. Then it is clear that our responsibility, or any other medical group responsibility as a surgical group, is to minimize all of the potential consequences derived from this trauma. How? There are many ways to do it, and let me give you some examples. Okay. For instance, optimizing surgical times. That means achieving a really good outcome in a very effective period of time. In other words, shortening surgeries is a good point, okay? Of course, use the adequate technology. Today, we know very well that not all the instruments a surgeon can use cause the same impact over the tissues, okay? So if you can contour the bone with ultrasonic tips that they treat extremely well the surrounding tissues, why should you use a conventional saw? This could be a good example. Another one, good preoperative planification by means of three-dimensional scanner and a specific software allow us to speed up the surgical process and to make it more predictable. This could be another good example. A very good support from the first second after the surgery. So use of cold mask, lymphatic drain massage, adequate medication, acupuncture. Another point, good nutritional support before and after the surgery. So as you see, we do not hide that surgery is a significant challenge to our body, but we want to provide so many different tools to handle it and to reduce all the negative effects that the medical trauma can have over our patients.
So, and Lil, did you want to add anything into that?
I think Dr. Capitán covered it all,
right?
But just to put the highlight on the fact that we have our psychologists there supporting everybody. So on the more mental health side of things, people who may have had experiences in the past with surgery or in healthcare settings that were traumatic, and helping them to work through those, that she's always there for them. So we take that into account as well.
I think that, things that are other teams may not be aware of is, understanding to use a person's, proper name, the name that aligns with their gender and their pronouns, and that naming their body parts properly when you speak about anything. I mean, in the face, it may not be as gendered, but to, understand that people have had other experiences, maybe interventions that might not have gone as well, and that to take that into account. And also, one thing I know that we discussed, that you discussed, and I got to watch you talk about is, I understand that sometimes, you have to show a person's picture, and it may be a photo from the past or something. Do you want to talk about?
In the consultation, the post-operative consultation especially, but also in the initial consultation, you see the photos. They're very specific photos with the hair pulled back and no makeup, so they're very unforgiving images, and they're compared, yes, with the digital simulation, the virtual FFS, and the initial consultations when they're involved. They're not always involved. And in the post-operative consultations, unfortunately, it's part of the process to have to see the photos that we take on site before in that same, unforgiving style, and the photos taken after surgery. So those are moments that can be triggering, and we're aware of that. Yeah.
And traumatic for a patient, and that I know that your team takes that into account. And I've had other people say that that wasn't taken in consideration. And I think that's shows your experience and your knowledge, and your expertise, and really thinking of the patient as a whole, and understanding that that trauma can be part of this, both in a medical way and an emotional way, and to have the staff that you have there to address either aspect is really fabulous. And so one of the things that I know that you all believe in, but I don't know if, and really work hard to make happen, is you use a holistic approach that for Facialteam that incorporates as part of your services. Would you talk about the holistic approach that you use?
Sure. As I said, we really want to offer a singular experience, and this singular experience starts once the patient contact us. Okay, so wherever in the planet the patient is. Okay, one of the main points in this stage is the info, what I call the info stream. So here I like to tell my patients that the more information they have, the better decision they can make. Okay, so this holistic approach goes from clear information to make, excuse me, I received a phone call. So it goes from this stream of information from the beginning to make their life easier in the whole process, okay? We really want the patient to be fully focused on their recovery and well-being. And that means that we need to deal with all the superficial stuff around their experience. So if they need to focus in things beyond the surgery, this is going to detract energy and strength to the patient, okay? So we need to be focused in all of the transportation, accommodation, all of this stuff, okay? So as you said, is a holistic approach aimed to let the patient be as focused, energetic, and balanced as possible to be totally in the surgery and not in all the around circumstances.
Right. Well, I know that when you were speaking before about being calm and relaxed, and if I remember correctly, I think you also include some form of massage and that type of aspect, I think, like in a holistic way. Is that correct?
Yes, the lymphatic drainage massage by Antonio. He's very popular. It gives you a couple of chill massages. And we also have Lolo, who is a neurologist who specializes in acupuncture. So he's a very, very knowledgeable fellow who does an acupuncture on the extremities, which is not only helpful for relaxation, which means you get better rest, which means you heal easier, but also it's apparently good for pain management for some people. Yeah, the nurses, so we have our own nurses in the hospital in addition to the hospital nurses, and the helotherapy, it's called, which are the facial masks that are applied in the first 24 hours are really important, and all the patients get those as soon as their surgery is finished.
Yeah,
that's important.
Right.
Yeah.
So I think we're taking the word holistic in two different ways: the whole person, and then the holistic healing approach way. And I think you have a perfect marriage of those two. And again, a very unique way to approach this. And again, for me, it's what makes people say you stand out to them more. And can you tell us about your team, Luis, and how it's structured behind the scenes at Facialteam?
I love the behind the scenes. I would say that. I would say it's a really structured and organized group of people. I would say it's a true team. And we can divide the team like in two big groups. The one in contact with our patients, including coordinators, medical and nurse department, well-being, psychologists, post-op department. And then we have the second group that is what I call the hidden group, okay? which makes everything happening at Facialteam for real. So we have the research and department and development department, the marketing and social media, human resources, technology, etc. So and one cannot live without the other. Okay, so I would say that it's a truly honeybee panel, the Facialteam.
Yeah, some of the people in the comments are saying they miss Antonio in that apart from the different therapies we have to help with healing and to give you the sense of well-being, is that they're saying, you know, just having somebody to talk to. Antonio loves to chat too. So.
Yeah. Well, I mean, I think that's again with when you bring in the family members and the partners and the friends to remind a patient when they leave, you know, maybe you want to keep this up. This was very effective for you before, and maybe this is something you might want to continue, and maybe a person would forget. And again, support after, post having the surgery.
Oh, we have a video, a do-it-yourself video.
Oh, that's what, yes, I was going to just ask you.
Yes. For lymphatic drainage, not for acupuncture.
Mm-hmm. Yes, I've heard about this. Yes. And so again, that's something that you offer that's very special. And I know that I keep saying, you know, Facialteam, but I think that more importantly is that what you're showing other teams and other surgical organizations, this is about education. What's possible? You know, everybody may not be able to come to Spain, or you have many locations, correct? That's another thing I want to make sure that we address.
Yes, Facialteam Spain has a location in Marbella and in Barcelona.
Mm-hmm.
And then there's Facialteam in Brazil, in Sao Paulo.
Yes. And so let's say you can't go to one of those organizations. Use the role, the model that maybe Facialteam you're hearing about here, and ask perhaps, does another place offer some of these services, or let them know that it's possible, because we're here to educate. That's the purpose of this series.
And that's someone in the comments is saying exactly that she feels like after finding Facialteam, she feels very well looked after, and she hasn't even come yet. And but she's also extremely more educated with all the resources that we provide. And yes, and we're happy to help patients and also present sort of a model, right, for care.
Exactly. That's why I was going to ask you, can you discuss your outreach and your research with other surgical teams in the field?
Yeah, I think it's growing and it's gaining a space year after year. It is true that some years ago, we felt kind of being alone in this scientific space. But all of us within this discipline, we have learned the importance of sharing knowledge, techniques, complications, difficult cases, because it is, in my opinion, is the clear path to evolve. Okay, we are fully convinced of that this integrated and multidisciplinary approach is the key. Okay, and we plan to continue with that for the years to come. As Lilia said, a good example is the numerous investigation and collaborations we have with different groups and centers with whom we have published our results and our protocols. So, in my opinion, is the path to follow in the years to come. Correct. Yeah.
Yes. I know someone personally who said they came to you because of what you were just talking about, and how you ended up, being so generous to other surgical teams or other people that were training, and they thought that was really honorable. Having not met you before, I'm going to get to hug you tomorrow with a mask on and meet you in person, and it makes me so. I'm so grateful that you have taken so much time with us today, and that you've allowed this series and supported this series with the two of us. And one question that people ask, Lil, so I have to ask you this, is how did Lilia's live streams come about, and why do you do it? No, I have to ask you.
Sure, yeah, it all started with the pandemic.
Oh, really?
Oddly enough.
Mm-hmm.
Unfortunately.
Yes.
And since everything stopped and we were confined, and I suddenly had a bunch of surgeons with time on their hands. So we wanted to stay connected.
No pun intended.
No
Surgeon
pun
time in their hands. Okay, good. Anyway, couldn't resist.
So yeah, I wanted to keep doing, you know, our work and stay connected with the community. And we'd been wanting to do something like this for a long time. So it's not something that came out of the blue, but just hadn't found the right moment for it. And so live streaming was a great way for us to do this, to keep connected when the world was practically glued to their screens in their homes. And it was an opportunity for us to finally get some of those debates and some of those important questions out there. And that's why we've continued to do it, because we found we're able to raise the voices of trans advocates and allies, as well as leading professionals, and putting trans healthcare and other issues into the medical mainstream, and as we educate the entire community.
Right, and I think that the isolation of the pandemic really escalated. You know, there were different peaks when people thought it was going to be over, and then it happened again, or people were waiting for their surgical date, and then it had to be postponed. And so what I, you know, hear is that you really adjusted. You went to Skype, and that now you probably have had more of a toolbox. So when people live far away and they don't have the money maybe to come or travel, you might have done that a little bit before, but may now see that could be effective in some cases. And so, and now out of that came this beautiful series, and that people can really become more knowledgeable about things they might not have known before. So what criteria do you use when deciding your guests?
Well, I'd like to say first that I usually say that we've hijacked this platform to give visibility to trans-related issues. I didn't ask permission to say that.
Oh, okay.
A bit cheeky there, but it's far from being hijacked, really. And this platform is donated by Dr. Capitn and Dr. Simon. And for me, it's an exercise in learning. And we learn from our patients, I learn from my colleagues who I interview here. I've learned today, and we learn from other folks in the community. And I feel that by putting this out here on YouTube, we're making inroads for trans acceptance, which is really important to me. So I take this responsibility seriously and seek out guests that help us to better inform, that are able to articulate about FFS and other issues, as well as the hardworking opinion leaders, activists, allies, and thanks to you, we've been able to I believe make this a more inclusive world with the information we're putting out there. So, and for you, your series, Dee, what's your criteria for the guests that you've brought on into the series here?
Well, I think it's changed over time now. There's the 13th. I mean, at the beginning, and I still feel strongly about that, is to include the companions, the parents, the partners, educators, teachers in schools, but also advocates very much, and very much those in the trans and non-binary community, to raise everybody's voice up, to put us all in, sometimes on panels or the same conversation, to learn from each other. We've had episodes where partners and partners and their both, if it's either a poly relationship or partners, come together with the person who is in transition or transition for themselves or identify as transgender. And to actually, or the parents and their child come, well, their adult child, because we don't need to be kids, and have educators come on, and people that have started organizations that are really meaningful to the trans community. And so I do a lot of reading. As an author, I think that's important, of course, and research and find out, listen to those when I present at conferences and go into their workshops and find who is vital and important. I mean, that's where we met, and listen to what the needs are that's missing, like what the gaps are that people aren't talking about, and bringing those guests on so that people become more educated. And I was wondering, where do you see yourself, Luis, in 5 years in relation to Facialteam and other professional ventures? No, it's my favorite question to ask.
So, I would be very happy if I'm 5 years time, I'm in a very similar position to where I am now. So that means enjoying doing surgery. That is something I really like and I really enjoy. I really enjoy also teaching and training young surgeons. It's something I really like. Well, I'm planning new strategies and new adventures for the future. So this is where I would like to see myself in 5 years' time.
And, I would think we'd be remiss if we didn't talk a little bit about Dr. Simon. Would you want to talk about his role in all of this and his inclusion with this?
I would say that Dr. Simon is my other half. I think it's difficult to live without Danny, and probably he would say the same. We have been growing so together, really close, hand by hand, and we have making decisions together. We have been doing surgery together. We have been doing everything by the hand. So it's exactly what I said. It's my other half, I think. What do you think, Lilia?
Half orange. They say in Spanish, media naranja. Yeah, in this case, Dr. Capitán's media naranja is Dr. Simon.
Yes, a true partnership, a healthy, professional, respected relationship, and that you probably each take from each other's strengths, and together it makes a better collaboration. And
decisions are, I would say that decisions are easier if I make it with Danny, and probably it's the same for him.
Right. And I think that seeing the way you two interact, you've brought that now to your team, where everyone feels part of the process, where everybody feels valued at Facialteam. Anybody I've spoken to from Facialteam has just beamed when they talked about anything that they did with your organization. And then me, I have, as we said, I haven't even met you, and I can't thank you again. I've said this, for the time that you're taking, the respect that you give me, that you've allowed me to do this, to bring me here and to understand the importance of companions. This lovely woman that I call her grandma, and she calls me granddaughter, even though people might think we would call each other the opposite names. And to have this chance to really empower the companions, as well as really listening to the voices of those who are seeking your services and the interventions. And is there anything?
I'd like to comment on that topic, actually, sure. Just to interject here, that I think that Dr. Capitán and Dr. Simon have done a good job in leading together, shoulder to shoulder as a team, and that's not easy. And I've been with them since before the beginning.
Yes, exactly. You were part of the process then.
So I've seen,
Lilia know it very well. Lilia,
yes.
It's a pillar. It's an institution herself.
Wow, I don't know about that, but I think that without their leadership, Facialteam wouldn't be what it is today. And they're, as leaders and being the role models they are at Facialteam, has created, I don't think any of the patients would deny, empathetic institution. Well, it's not an institution, but
organization. Yes.
We're empathetic in lots of different departments, but we're united with that empathy for the patient. And I'm sure that in the professional training that you're going to help us with on Friday, we're gonna talk about that a little bit too.
Yes.
And it's a key aspect of everything we do.
I mean, I can feel your warmth through the screen, and you don't always find surgeons like that. And it's clear that that's who you are. And when you do this, I mean, we always say the heart, but I can see that heart, and part of your symbol, this is all heart. Even though it focuses on your face, it stems from your heart and it comes through. And I feel that a body that will even consult with you, whether they use your services or not, will be better for it and will become away more educated more knowledgeable, and be able to make the right decision for themselves, and that you will respect their needs or their not needs and be honest with them and be realistic. And so I guess the last question I would like to ask you is there anything about FFS Facialteam, or you as a professional, that I should have asked you that I haven't done yet? Because I would want to give you a chance to ask yourself your own question, or ask yourself your own question.
Well, probably there are many topics that can be approached in new series, in new lives, Lilia. For instance, like we said it before, the change in the age range from the beginning to nowadays is something that really caught my attention. Also, I'm curious to understand the impact of the new standard of care number 8 is going to have in the trans community and in the trans health care and professional. This is going to be another important topic for discussion. Also, new trends and habits in the young trans population, together with the social changes we are seeing constantly, how this is going to affect and to change the FFS in the future. So there are amazing topics to be discussed in new lives.
Thanks for the suggestions. I'll take them all into account and really incorporate them for future interviews. I think they're all great. And I didn't think of that. So it's good.
Yeah, these are great suggestions.
I mean, that's what this is about, learning, right? We're always better, lifelong learners. As an educator, that's, the school district I taught in, that was one of their mottos, and we're all lifelong learners. And regardless of what your role is, we could always improve and along the way.
Absolutely.
Anything about you, Lil? Anything you'd want to add in?
Yeah, I want to show people your books. Can I show you
okay,
your
sure.
books?
Thanks, Lil. She's so good. Thank you.
It was a pleasure talking to you and having you here. You make it very easy. You make it very really easy. So I enjoyed a lot the interview, and it was more than an honor being here.
Thank you. I love to talk, and I want to set this up that it's a safe space, that you feel like you're in your living room or somewhere that's very cozy and comfortable for you. And so thank you. It means a lot to me from you, especially, of course, you could imagine how it feels for me to know that you've taken this amount of time with us today to have this conversation.
On the contrary, it's a real pleasure. It's a real pleasure, and I hope we have the opportunity. Yeah, I see you tomorrow. Exactly, in Marbella.
Yes. Thanks, Lil, about the books. I appreciate it so much.
No problem. Yeah, I shared those books so people can see, and this video is going to be saved on our channel so people can come back and watch it and see the links in the description and to buy these books if you're interested. And I'd also like to announce the next live next month with you on May 18th. In
the US, and you'll be in Spain. You know how much I love it here, Lil.
I'll have to chain you down.
And I just need to do a shout out to your youngest daughter, who did our nails for us, and that Lil like me, so we could be twins today. Our team jackets and same shirts, and then we coordinated.
Today, Lee is a facial teamer.
Yes.
You're gorgeous. You're gorgeous.
Thank you. Coming from you, that means a lot.
You're gorgeous.
Yes. So,
very good.
So the next one would be on May 18th.
Yes, with Katie Lakin.
Yes. And so she wrote the Gender Identity Journal. She's wonderful. I'm really excited about interviewing her. So she'll be here with us. It'll be the time we usually do, which is 10 a.m. Eastern Standard Time.
4 o'clock.
Yes.
European time.
Yes, European time. And so yes, we'll be doing that. And then we have one in June. So we're all prepared.
Yeah, we're working on future ones.
Yes.
We'll also have more live streams coming from Facialteam and other guests in the coming months. So stay tuned. Keep an eye on our website for the schedules. And also never ever forget to like, follow, share with this video with your lovely friends. And Like I always say,
Okay.
do you want to do it this time? No, you have to do that.
With heart. From our, you do with me.
Okay, you ready?
From our heart to yours.
Exactly. Remember that you are not alone and your health and happiness matter.
Yes.
Thank you. Bye-bye.
Bye. Ciao. Okay.